A nationally owned private hospital in the country, Paradise Private Hospital, is not part of the Health Department's polio vaccination program. With the outbreak being a major concern throughout the country, Director for Paradise Private Hospital, Dr. Polapoi Chalau, has questioned why the government has not partnered with them. He says while the hospital provides day-to-day health services to expatriates and ordinary Papua New Guineans, families are more at risk as polio vaccinations are becoming a costly exercise.
Since the announcement of the polio outbreak a few weeks ago, we've had an influx of clients coming in to access our services and also fear of the outbreak of polio because by the current information, the polio was supposed to be eliminated. Okay, that was almost 10 years back, but now it's re-emerged again, so we are equally as concerned.
He questioned why government-partnered hospitals that have received free polio vaccine supplies are selling polio vaccinations. Cost is also a major factor for families and individuals to purchase polio vaccines and those planning on traveling abroad.
Our position in Paradise Private Hospital, polio vaccine has always been one of the vaccines that we provide and offer to all our clients, particularly the newborn babies and those who have not been vaccinated and come in here to source out the vaccine. So we've been providing polio vaccine. It's not something new.
Paradise Private Hospital, to cater to the growing demand of its patients, purchased its polio vaccines and is charging at 160 kina, while government-funded hospitals that have received free polio vaccines from government funding are Pacific International Hospital, that's charging nationals at 75 kina and expatriates at 86 kina, while public hospitals are charging at 12 kina. Dr. Chalau says his major concern is to stop the spread of polio, and the government should go behind all hospitals in the country to work together to stop the spread of polio.
It's something of national importance and very sensitive. We are going by what is being directed by the central agencies to follow. So we follow accordingly. The doses that are given, the age group that are given, the time period and all that, whether it's oral or injection. So we follow the same protocol that is being given to us by UNICEF, WHO and the Department of Health.
Dr. Chalau is pleading the Department of Health will include PPH to be part of its polio vaccination rollout program. With international countries made aware of the polio outbreak in the country, those planning on traveling overseas will be affected as they won't be able to live without being vaccinated and a stamped receipt on their visa as proof of vaccination, and vice versa for those traveling into the country. Not only has the outbreak put families at risk of contracting this incurable disease, but has put the lives of many Papua New Guineans, especially children under the age of 5, at high risk. Public is advised that although public sanitation and careful personal hygiene may help reduce the spread of polio virus, the most effective way to stop the spread of polio is through vaccination. Godwin Eki, National, EMTV News.